I think we can start, Jackie.
And quick reminder, I know I'll go over this again when we do our opening remarks, but panelists and committee members, please update your name in Zoom so everyone can be familiar with you as well as your organization that you represent. So we're going to transition into the session. Right now, we're just in the practice session. We'll wait momentarily to allow those who are public attendees to join the meeting, and then I will move forward with spotlighting myself as Rex, our ALS interpreter for today, and then we'll go from there. I'm filling in for Carol today, so I know she is a rock star at this, but I think we can do it all together with the support of everybody on the call. So let me start the webinar. Greetings, everyone. We are doing the Elder and Disability Justice Coordinating Council. We're going to wait just a moment or so to allow others to join the call as well as get the spotlighting going. I think we are ready to go. Welcome and good morning. Hi, everyone. My name is Jackie Tompkins. I serve as the project director for California's Master Plan for Aging here at the California Department of Aging. Sharing with you that we are meeting today for the Elder and Disability Justice Coordinating Council. Today is August 8th, and we'll be meeting for about 3 hours today. Before we delve into today's robust and comprehensive agenda, I just want to walk through some meeting logistics for those of you attending either as a committee member, a panelist, or even as a public member. So meeting logistics, we are offering this session as a webinar or telephone option. Live captioning and American Sign Language interpreting is available for this session via Zoom. We will post the meeting slides, the transcript, and recording of today's session on the California Health and Human Services Agency's Master Plan for Aging webpage. So you all will be able to access, again, the meeting slide, transcript, and recording following today's session. And just a quick reminder for committee members as well as presenters and panelists that may be joining us today. Everyone wants to know who's on the committee, who's joining us. So please take a moment to update your committee name. Right now, it just says EDJCC member, but please update your name, clicking on the upper right-hand corner of your square, selecting the 3 dots, and select rename. Next slide. In terms of additional meeting operations, the Zoom chat functions are only enabled for the EDJCC committee members, Department of Aging staff, and other state staff, as well as the invited guest. The public will be able to view the content that is shared during the chat, and however, the chat and the question and answer functions are not enabled for public attendees. We have time on today's agenda to provide for public members to provide any comments at the end of today's meeting, but you can always email us at engage, ENGAGE, at aging.ca.gov at any point and share any type of public comment related to this meeting. Next slide. When we get to the point of moving forward with the public comment session, just wanted to note that any attendee joining by phone needs to press *9 on your dial pad, and that will notify us that you have a public comment, and we'll announce the 4 digits of your phone number and unmute your line. Attendees joining the webinar, you just simply click raise hand button on your Zoom function, and we'll announce your line as well. You have 2 minutes. Each public commenter has 2 minutes to share your comment. And again, the engage.ca.gov is always available for you to share such comments. Before we move forward, I do want to take a momentary pause. It appears that maybe on our public-facing side, we are not seeing Rex, our ALS interpreter. So I'm going to try and see if that changes it for those of you on the public side in terms of being spotlighted. I do want to turn it over to Consuelo, who serves as our Tribal Engagement Manager here at the California Department of Aging, to provide us with a land acknowledgement.
Thank you, Jackie. Hello, everyone. My name is Consuelo Gambino, and I am the Tribal Affairs Manager at the Department of Aging. And I am from the Yuki tribe and an enrolled member of the Round Valley Indian Tribes in Covelo, California. So it's a pleasure to be here with you today and an honor to do the land acknowledgement. So today, as we attend the Elder, Disability, and Justice Coordinating Council meeting, we take a moment to acknowledge the tribal lands in California on which we are gathered. For many centuries, the lands in California have been home to numerous tribes who have protected and respected the sacred lands which we all reside. The tribes in California are sovereign nations rich in culture and traditions passed down from our tribal elders. I am attending this meeting from Roseville, California, and acknowledge the indigenous homelands of the Nisenan Maidu people and honor their resilience and cultural preservation. Thank you. I'll pass it back to you, Jackie.
Thank you, Consuelo. From here, I'm going to transition it over to Rajana, and she will introduce not only the agenda, but some of the committee members today, as well as walking through some guiding principles of the EDJCC committee. So let me spotlight you.
Thank you, Jackie. Thank you, Consuelo, for the meaningful land acknowledgement. EDJCC is really excited to have you join today, and we look forward to your presentation later in the agenda. My name is Ranjana Maharaj, and I have the privilege of serving as the Elder Justice Specialist for the California Department of Aging. And I want to thank everyone who is able to join today. Before we dive into our agenda items, I'd like to take a moment to revisit the council purpose and to go over our equity guiding principles. So our council purpose is the goal of the Elder and Disability Justice Coordinating Council is to increase coordination and develop recommendations to prevent and address the abuse, neglect, exploitation, and fraud perpetrated against older adults and adults with disabilities. Next slide, please. For our equity guiding principles, we recognize that past interventions and services to prevent mistreatment have had negative consequences for some victims, families, and communities as a result of systemic discrimination and biases. To counter these negative impacts and to ensure equity and inclusion moving forward, we're committed to letting the following principles guide all aspects of our work in planning, coordination, and program development. I have the EDJCC chairs that will help me with the equity guiding principles. Next slide, please.
Thanks, Ranjana. Our equity guiding principles are as such. 1, we recognize that all adults deserve to live free from abuse, neglect, and exploitation. 2, we acknowledge the existence of systemic racism, discrimination, and negative impacts. In order to combat its impacts, we must center equity at all stages of our council's work. 3, centering around equity does not just mean creating equitable solutions for all older adults and adults living with disabilities, but also recognizing that implicit bias exists within us all. We are committed as a group to acknowledge and explore biases while doing the work of this council. And I'll pass it to Berta.
Thank you, Vivian. We acknowledge that while older adults and adults living with disabilities have many overlapping interests, they are distinct communities, and any policies that are observed or recommended by this council should be examined impacts to each community. 5, we recognize the importance of hearing directly from older adults and adults living with disabilities. Their lived experiences should always be centered as we move forward with the work of this council.
Thank you, Vivian and Berta. Our council serves as a platform for collaboration, innovation, and collective action. So we're here to amplify the voices of older adults and adults with disabilities.
addressing systemic challenges and safeguarding their rights. So with this purpose in mind, we'll go ahead and move forward. And we have the council members. On these 3 slides, we've highlighted our esteemed EDJCC stakeholder members. These individuals play a pivotal role in furthering our mission and advancing our initiatives. So while we won't dive into the list in detail at this moment, but we'd like to recognize and appreciate their valuable contributions. Next slide, please. Thank you. Thank you, Kelly. For today's agenda, we started with the meeting logistics and land acknowledgement. Next, we have opening remarks from Director DeMorris. Then we'll hear from our EDJCC subcommittee chairs regarding the 2024 reflections and day of action recommendations. Followed by those topics, we'll have a discussion on the 2024 Master Plan for Aging Day of Action. After a short 10-minute break, we'll have a tribal presentation from the California Department of Aging, followed by a presentation from the Administration for Community Living on the National Plan for Aging. We'll wrap up today's agenda with public comments and next steps. So without further ado, I'd like to introduce our California Department of Aging's Director, Director DeMorris.
Thank you, Ranjana. Thank you, everyone, to our staff and our stakeholder leaders and everyone who's joining the call today. I really look forward to this group. I learn so much every time, and I'm also inspired by the work that's happening around the state. You give me hope that we are, listening to the guiding principles that all of us on this call and people joining from the public are doing our part to right the wrongs that are happening for older adults, people with disabilities, and family caregivers. So I wanted to just give a few updates. We're already running behind. First, I wanted to highlight in the state budget that has been signed since we last met that overall, by and large, we were able to protect most of the programs and services that support vulnerable older adults, people who are at risk of abuse and neglect, people with disabilities, and family caregivers. And I will single out specifically the preservation of adult protective services that was, and thank the governor and the legislature for making the commitment to these programs. I also want to highlight, since we last met, maybe when we met, it was expected or at least anticipated that Proposition 1 would be approved by the voters. We now know that to be true, and work is happening at the state level, at the county level, certainly with the Department of Public Health, the Department of Healthcare Services, HCI, around workforce investments, and we really see a lot of potential in Proposition 1 to bring local investments and statewide workforce enhancements. And we'll be updating you, and there's a lot of crossover with the EDJCC. I also wanted to share that we're very proud that we've concluded California's first ever statewide survey of LGBTQIA+ older adults, and we had a good response of 4,700 people took the time to respond and submit their survey results. We're really pleased with that result, and we'll be able to release our survey findings early this fall. So we're looking forward. Again, there's intersection with this group. And as a department here at CDA, you just heard from Consuelo. Thank you for your land acknowledgement, and she'll be presenting to this group later in the agenda. We're initiating more formal engagement with tribal communities. And I want to thank you for inviting and welcoming Consuelo to today's agenda. We also, since we last met, we have hired the Department of Aging's Chief Legal Counsel, and I'm so proud and pleased to announce the hiring of Brandy Duvall as our legal counsel. Brandy's joining us today to listen in to the meeting, and her team in our Office of Legal Services intersects quite a bit with the work today. We're just thrilled to be working with Brandy. And then I just wanted to touch a big focus of today's meeting is hearing your stakeholder recommendations and how this will feed into the 2025-2026 Master Plan for Aging initiatives. And I just really, really wanted to take a moment to express my sincere appreciation and acknowledge the leadership of the subcommittee chairs and their work on recommendations. You've spent a considerable amount of time in your individual subcommittees, but also working across subcommittees where there are intersections and overlap. So I just really want to thank you for leading us to today, and I can't wait to hear them presented to a wider audience. And then I wanted to clarify too that the role of the state members you saw on the slide, we're so fortunate to have so many state partners who serve on the EDJCC and who are here to identify issues and consider solutions. They won't be weighing in officially today or endorsing the priorities, but they're taking them in under advisement, and we'll be working very closely with them after the day of action on October 8th, which you'll hear more about in the agenda. I hope everyone here has registered. If you haven't, please do. But after the day of action in October, we work with all of our state partners internally, other departments, other agencies to consider the recommendations that are brought forth and to develop a final set of initiatives, which will ultimately be signed off, reviewed and signed off by the governor's office. And we must look at factors that influence those recommendations, including the fiscal impact, resources, and state capacities. So we start today, we hear the recommendations, they're lifted up to a wide audience on October 8th, including lots of state administration, representatives of the governor's office, cabinet members, state departments, and the legislature. And then we announce officially the 2025-2026 initiatives in January, and those become our guide for the 25-26 two-year session, and they parallel with the legislature. So we're getting close. We're on the home stretch now, thanks to all of you and your diligent work over the last several months, bringing these recommendations forward to the group. So I will stop there and just thank you all for joining today. Thank especially our CDA team that works so hard to produce these meetings and to do the follow-up after the meeting. And Ranjana, turn it back to you. Thank you.
Thank you, Director DeMoras. Next slide, please. At this time, I just want to echo Director DeMoras' sentiments on our amazing EDJCC subcommittee chairs who play a crucial role in advancing our mission of this council and all the work that we're doing for the Master Plan for Aging recommendations. So at this time, I'd like to introduce our Legal Services Chair, Vivian Mabaku, our Adult Protective Services Chair, Akili Saron, and our Conservatorship Chair and our Stakeholder Co-Chair, Bertha Hayden. I'll go ahead and pass it over to the chairs. Next slide, please, Callie. Thank you.
Thank you, Ranjana, for that introduction, and thank you to the CDA team for your incredible leadership. Being a stakeholder co-chair and serving along with fellow co-chairs, I'm often taken aback about the real-time impact that our work together is able to bring statewide. All of us are in different locations throughout the state, and yet working together, we're able to immediately give a hyper-local impact of the strength of this council. So thank you to the CDA's team. Next slide, please. For this portion, I'll turn it over to Vivian.
Thanks, Berta. So we're just going to go over some of the work that we've done so far this year. It's been a really busy year for the council, and we've also experienced a lot of change. So in March, our chairs the chairs do meet every month, but our committee chairs met and we reviewed our existing initiatives and then started planning for our new initiatives that will be presented at the Day of Action in October. And really our goal is to make sure that anything left over from existing initiatives is really folded into our new initiatives, and that we're not just leaving old issues on the table. In April, we were able to submit a letter that is related to a request for information from the Federal Elder Justice Coordinating Council. They reached out to the elder justice community throughout the country looking for recommendations for improving their council. And so we were able to send out a survey and get some feedback from council members and quickly submit a letter. And we're hoping that we're going to be able to take advantage of these types of opportunities in the future. And just this past month in July, we also started a new kind of format for our council members to get more information about issues related to elder and disability justice. So we had 2 listening sessions. We had a listening session with a representative from Cal OES, and we had a really robust conversation about VOCA funding and how VOCA funding is impacted. There are some pretty serious cuts that have come down from the federal level, and so we had a really great conversation brainstorming how that's going to impact elder justice programs and disability justice programs, how it will impact California, and ways that we can plan for sustainability of these programs. And then we also had a full council listening session to talk about the trajectory of the council, how to make the council's work more impactful, and how to keep up participation amongst council members. So we received a lot of really great feedback from council members that we're going to be implementing. One in particular is getting individual council members a bit more involved in agenda setting and really looking at ways that we can make our work more impactful. So really excited to see some of those recommendations moving forward for our meetings coming up next year. And today we will be reviewing the recommendations that our individual subcommittees have come up with for the MPA Day of Action. We're still refining and finalizing those to be submitted, but we will be able to discuss what our individual subcommittees have come up with so far.
So just as an overview, the process that's been followed in our individual subcommittees has been, thank you to Jackie for coming to our subcommittee works and really working with all of us, providing the introduction of the tool to help us really hone in on the recommendations, using our subcommittee discussion times to just mainly focus on the recommendations. Again, we want to highlight the EDJC listen session and thank our members for adding an additional meeting to their calendars, allowing us a time to work outside of our subcommittees, but coming together as a whole to be able to give that different lens and hear recommendations from people that might not participate in certain subcommittee members, subcommittee. And then we also now are at the point where, as Vivian mentioned, we have draft recommendations that we'll be reviewing today. And that in the couple of short weeks left, that we will be continuing to refine those. Next slide, please. So again, I think Vivian just highlighted it, but it is worth stressing that for all of us, I think at the time in where the EDJCC is, that we really are looking to be focusing on sharing what we as a council for the state of California, who thanks to our leadership at the CDA and at the governor's office are really doing innovative work. And, we recently, the Federal Elder and Disability Justice Coordinating Council had a celebration of their work. And it was interesting because it involved all the federal agencies. But with our council, we really are enriched by bringing the stakeholders' experience forward. So we just want to take a moment to acknowledge that. And we provided that feedback that, the Federal Elder Justice Coordinating Council could perhaps also be enriched by adopting a similar, changing their structure to perhaps add stakeholders like California has done. And again, the learning that has been done, we want to again thank Lee Bills from the Cal OES office that really took time, not just to give an informational update on funding, but really to delve in and to teach the EDJCC council members about the structure of funding, of forecasted changes that really helps all of us who are working on the ground within our different programming better prepare and better partner for these shifts that ultimately are a benefit to the older adults and adults with disabilities living in our state. And finally, again, we just wanted to thank the council members and stakeholders for participating in our listening session. It has been quite a flurry of meetings, and all of the membership are experts in their own right and have full-time jobs. And being so invested and engaged is invaluable to the ultimate recommendations that we do. So thank you to our council members and stakeholders for giving that and participating in those sessions. Vivian?
Thanks, Berta. Next slide. Okay, so I will start off going over the draft recommendation for the Legal Services Subcommittee. First off, I would like to give thanks to my fellow co-chairs and also everyone on the Legal Services Subcommittee. We have had several meetings, some really robust discussions, and I appreciate everyone's input. As I said earlier, these are draft, so we're still working on finalizing the written versions that will be submitted to CDA, but this is basically what we have developed. So the Legal Services Subcommittee has agreed that our overall goal is enhancing and increasing access to civil and criminal remedies for older adult victims of abuse and exploitation. And within that, we have 3 sub-goals that kind of explain what that phrase really means. So supporting all attorneys that serve older adults, supporting new models of service delivery to empower older adults, and statewide collaboration with the Attorney General's office. So to delve into these specific sub-goals, supporting all attorneys that serve older adults, including members of the private bar, state, and nonprofit attorneys. We believe this can be achieved through supporting and encouraging private attorneys to take civil elder abuse and exploitation cases, particularly in rural areas of the state where we know from our stakeholder members, they have expressed that there are issues with older adult victims having trouble accessing private attorneys. There are not many private attorneys who actually pursue these cases, and legal aid attorneys are limited also in rural areas of the state. This also includes creating robust referral networks for the public between the private bar, legal services, and prosecutors. Currently, there isn't a referral mechanism that would enable, for example, a prosecutor who is not able to pursue criminal charges in an elder abuse or exploitation case to refer to a private bar referral list or potentially even to legal services. So we are looking at the opportunity to create referral networks for the public so that older adults are able to access legal representation when needed. And this is particularly important because in a lot of these legal cases, time really is of the essence. For example, if someone is facing foreclosure, they really have limited time to be able to access legal representation that can preserve their legal rights, preserve their housing, preserve their generational wealth. So it's really important that we create an opportunity for older adults to kind of have a one-stop shop to be able to get legal representation. And then finally, supporting legal services organizations who serve older adults with training, funding, and loan repayment programs. So this kind of follows some of our previous recommendations from the previous iteration of the MPA. We have had several discussions this year amongst the legal services subcommittee about the issue of public interest drift, in which legal aid organizations are not able to keep legal aid attorneys and employed for very long because most legal aid attorneys carry significant student loan debt, which leads to people moving on to higher paying positions. And while the federal reforms of the student loan system and new payment plans have helped alleviate some of these issues, it still has not, solved the problem that many legal aid attorneys are paid lower than those in the private sector and do face significant student loan debts, and which leads to them leaving legal aid much sooner than we would want them to. So supporting these legal aid organizations through supporting the loan repayment programs that have been created here in California, and other options that might be available to really help keep great legal aid attorneys at legal aid, and support those who want to work in legal aid. As for supporting new models of service delivery, we think that can be achieved through uplifting existing service models, and creating new ones to provide estate planning services to all low-income older adults in California. We also had a meeting last year with a legal aid organization from Northern California that explained to us their model and how they are able to receive some funding from some city and county funding to provide estate planning services to low-income older adults. And in particular, they talked about how this really helps preserve wealth in low-income communities, and many of these communities are communities of color, and how keeping a home or other assets within a family after an older adult passes is able to create stability in these families, and also keep these communities of color in the communities that they've been living in for decades. Also, this includes creating service delivery models that provide older adults the option of restorative justice approaches to elder abuse and exploitation. So this falls really in line with our equity principles. There are some people who are looking at restorative justice models, and we really want to support that work and find ways to get that work statewide so that all older adults can really have that option, other than just the option of police and prosecution in cases of elder abuse and exploitation. And then also finding funding to support legal aid organizations who are creating new service models. We know that there are organizations out there who have new funding models, they're trying new things, and we really want to uplift those organizations. So in addition, if you know of any unique service models that legal services organizations are doing here in California or elsewhere in the country, feel free to email us, because we'd love to learn about them so that we can spread that information here in California. And then finally, the statewide collaboration with the Attorney General's office. So we really want to engage directly with the California Attorney General's office on increased statewide collaboration efforts on elder fraud and scams. Previously, at a full council meeting, we did have the AG's office come and talk about their Medi-Cal fraud office. But we think that there is a really missed opportunity to have some direct engagement with the AG's office on pursuing elder abuse and fraud that's not related to Medi-Cal. We've heard from stakeholders that there are local police and prosecutors that are interacting with victims of elder fraud and scams, and there's not necessarily the resources at the local level to pursue these types of fraudsters and scammers. And we would like to engage with the Attorney General's office on some widespread statewide advocacy on these issues. So those are our recommendations as of now, and as I said, we're finalizing everything, and we'll get this submitted to CDA. But I will pass it on, I believe, to Achilles for the next slide.
Hello everyone, Achilles Cerrone. I am the APS subcommittee chair, and we'll talk about our recommendation. A little bit of background. First, the world of elder justice has several components to it, and hence how we work together, the chairs. You have the prevention side, for example, education, prevention. You also have the remediation side of what to do when there is abuse, and exploitation, neglect, and all types of abuse in California. What we've been focusing on is on the intervention side. When someone suspects that an older adult or an adult with a disability is suffering from abuse or being subjected to abuse, neglect, exploitation. Um, Most people will make a report, and then we have mandated reporters who need to make a report. These reports are based on jurisdiction, and that may be confusing from where does the older adult, the adult with a disability reside, independent living, in the community, is it a long-term care facility, and many settings in between. In addition to the mandated reporting system, for example, you have the mandate to make it to the specific agency with jurisdiction or to local law enforcement. And as some of you might have heard over the years through several discussions that we've had, that may create confusion for the reporter. It may also delay the timing of the intervention when agencies may be trying to determine the jurisdiction and who should be responding and when. So what we have come up with for our recommendation is to redesign the system so that these reports of suspected abuse of older adults and adults with disabilities could be made to a single phone number that would be then sent to the region or county with jurisdiction where the suspected abuse is taking place. So we are calling these right now the California Reporting One System Services. That's what we're proposing, or CROSS as an acronym. And the idea is that through this process, resources would be provided to all 58 counties to establish this system. Some counties may be substantially small, and they may decide to that this would work better at a regional level. So that is the thought behind. So when someone needs to make a report, regardless of the setting, the community, etc., they would only call one number. The report would be received, it would be assessed, and the timely response would happen for a proper intervention of the person who is suspected to be abused. For agencies that are designated to implement this CROSS, to receive the funds and to hire and provide training to the staff who would be receiving these reports, would be triaging, understanding the nature of the circumstances, making all the appropriate CROSS reports currently mandated by state law, and ensuring that all these agencies would receive the report that they based on state law, are supposed to receive. And most importantly, that the local resources that need to be deployed most immediately or within a specific period of time is done through this system. The designated agencies would organize and oversee these partnerships. And we're thinking about amongst adult protective services, area agencies on aging, long-term care ombudsman programs, mental health services, local law enforcement, and appropriate state regulatory agencies. So this process would coordinate and really oversee that the receiving and responding to these reports for a timely intervention is happening. So that is what we will be recommending as the APS subcommittee. And with this, I will pass it on to Bertha.
Thank you, Achilles. Next slide. And looking at the for the conservatorship draft recommendations that our team is continuing to, just this week we updated them again and are recirculating them to our memberships for updated comments. So I'm going to more talk about the themes that are present in our recommendations. And as it was mentioned in the earlier part of the session by Vivian, is that our work really started by looking at what was initially proposed in past initiatives to make sure that the work that had been recognized as a priority is not left behind. And so with that, our draft recommendations are really looking to continue on the theme of modernizing the infrastructure of the public guardian system. Our subcommittee is luckily that we have memberships of individuals that are working within the public guardian system, and so that our perspective can be enriched by their day-to-day work. And what we're looking to do is to really make sure that the public guardian system that was designed to assist the most vulnerable older adults or adults with disability in California is strengthened and resourced in order to achieve just that. I believe it was some of the committee members that have recognized that lately that many of the legislature has even looked to the public guardian to help with new programming to help vulnerables, to help vulnerable individuals, including care court. And so as more is being asked of the public guardian system, we want to make sure that it is ready for that to serve those individuals now, but also the increasing amount of older adults that may need it in the future. So we would like to see that public guardian systems are mandated throughout every county so that older adults, no matter whether you're living in a county no matter which county you're living in, you're receiving the same equitable resources from our public guardian system. We'd also like to take a cue from our APS partners of Achilles subgroup and the APS team a couple of years ago. Were able to strengthen APS by having a program administrator that's now at CSS, and we'd like to see that replicated from the public guardian program administrator. We feel that having someone in the state office that's able to serve as the connector for all the public guardian systems across the state will again serve to ensure equity for all older adults throughout California. We also realize that it's important to evaluate, and very much building on what Achilles just said for APS, the system coordination that is done. APS and Public Guardian are critical partners that work in hand together, and also how Public Guardian receives referrals from other agencies and how we can increase the visibility of system coordination for stakeholders and community partners so that we're not creating information gaps, but have information bridges that and quickly enhance the opportunities for positive outcomes for older adults. So our recommendation will include about the evaluation of system and coordination. We also, as a subcommittee, spent much of last year really looking for data and concrete and evidence-based research on conservatorship and public guardian to be better informed as how we as a group were making these recommendations. And what we found is that there's a lot of data buckets that are separate, that don't tell the continuity of the story statewide. And so we would really like to see, and that really affects what we can inform prioritizing around resources. It really impacts exactly what the level of need is. And so we'd really like to see that improve by establishing a data tracking and statewide training standards. Again, we feel that with the modernizing of the infrastructure, the evaluation of system coordination, and the establishment of data tracking rules as the general themes that will be fleshed out in our recommendations, that it will promote and ensure equitable justice experiences across all of 58 counties for all older adults and adults living with disabilities. Next slide, please. So I think this is when we have the opportunity to open it up and hear from our members. If you would like to add something that you believe might have been missed, we'd like to open this opportunity up for discussion.
I'd like to highlight Lisa asked a question. Lisa, would you like to ask the question live?
Sure. My question was just as you were doing your presentation of what do you see the role of the state legal services developer with your committee, and also what's happening with that position? I don't know if that's something you could answer or one of the reps from the CDA.
I will leave that to CDA if they'd like to respond, but I do think there is a role for the legal services developer. within this, especially looking at the collaboration with the AG's office and looking at funding for legal aid organizations. And I look forward to having whoever the new legal service developer is on our meetings so that we can talk to them about CDA's role. Oh, and I think Brandy is here. So Brandy, go
We
ahead.
have Brandy online.
Yes. Hi. Thank you for the question. So as for the role, we are in the process of screening applications, and we hope to fill the role very soon. As for the possibilities of the individual and the impact and the work that they can bring, we've had some conversations about that. Obviously there's a there's a collaboration piece. I think to start, we would need the person in this role to be prepared to engage in listening. I'm not certain that I'm not certain that I will be removed from the work. I actually want to work very closely with this person, and I want to create the space so that the state legal services provider is able to work across counties, work closely with our local partners to Okay, sorry. I'm sorry. The host is asking me to start my video. Um, Work across states, work with local partners to address some of the gaps that have appeared. Just like specifically, we talked about issues related to homelessness and issues related to conservatorship, issues related to fraud. I'm My goal would be to create partnerships so that the legal services provider is really creating like a network and something that CDA can help grow and expand across the state. And like I said, I also want to continue to attend these meetings. I'm also going to be working with the legal services provider. Previously, the chief counsel was the legal services provider. So I see myself as partnering with the legal services provider because when I take that big step back, it feels like this is something that there's enough work here for the legal services provider and the chief counsel to play a role in this process. So I hope I answered your question.
Yeah, and that's really great to hear. It definitely seems like that, there's so much work, and I would hope that when even I don't know, even during the hiring process, that your office would work closely with the subcommittee, which has been doing really great work. Vivian's committee, I think, could be an enormous resource.
I hadn't thought of that. I think that is a good idea. It seems like something where I might need to work with the HR here to have the subcommittee formally involved. But at the very least, I think it is incredibly appropriate to do some informal involvement, just as far as like just some of the thoughts and ideas and the needs and how those needs can be met. So I like that idea.
Great.
I think we have another question. Jason, did you have a question? Jason Sullivan,
Hey.
helper. Hi.
Yeah, can you hear me okay?
Yes.
Yeah, thank you so much. More of a comment than a question, actually. So, hi everybody. I'm Jason Sullivan Halpern from the Long-Term Care Ombudsman Association, and I just want to recognize your work group, Achilles, for making the idea of a single unified reporting system for elder and dependent adult abuse and neglect a priority um, in your recommendations. And as many as you know, the long-term care ombudsman program worked very hard to revise the mandated reporting system in long-term care this past year with Assembly Member Wood through AB 1417. And just wanted to point out that when we were, trying to get that bill passed and we were having meetings with legislators and other stakeholder groups, one of the things that we emphasized was that California has the most complicated system for this in the nation. And that has a large part to do with the fact that in a lot of other states, the agencies that are tasked with responding to these reports are within a larger government agency, like they're all under one roof. In terms of APS and the ombudsman, you've got APS located in the Department of Social Services and the ombudsman located in the Department of Aging. And I think, as you probably have discussed in your work group, like what that causes is a system where we have two separate databases, and we have people reporting to two different agencies depending on whether they're living in the community or they're like living in long-term care. So most states have a single phone number that you can call, where that information is cross-reported to the relevant agencies. I think we might be one of the only ones that does not have that at this point. And it's really a huge barrier to people reporting abuse and neglect because they just can't figure out how to do it properly. If there was one phone number that you could call regardless of the setting, I think that would drastically increase the number of abuse and neglect reports that we receive. And so we're excited at the prospect of that. I think when we talked to a lot of people about AB 1417, like the fact that that would cost the state money came up. So that's something we'll have to overcome. But I think that is definitely something that's worthy of being a recommendation for the MPA for the following year. So thank you so much for discussing that with the work group and coming up with some recommendations around that.
Thank you. We really appreciate it.
Jason. Any other questions?
I don't have a question, but I just did want to go back to the Legal Services Subcommittee work and the work that CDA is doing. I just want to take a minute to uplift the work that Justice and Aging is doing with the CDA to work with legal aid providers that are providing services under the Older Americans Act. That partnership has really created community, and I'm really excited for I know that there'll be an upcoming report and recommendations, but I think having worked in legal services for 10 plus years, it's been really incredible to see the visibility of CDA increase and be able to have firsthand partnership with CDA. And Brandy, thanks to your department and Director DeMorris, because it really helps us on the ground, as I think it was taking my EDJCC hat off and just being a legal services provider. What Vivian was saying really resonated. And I'm really excited by the recommendations that are being put forward, because legal services will always have more limited resources than the need. So it becomes about working smartly. It becomes about working together so that we're not all, there's no need to replicate the wheel, the sharing of resources, the creating of the networks. And that really seems to me of work that's being started by the CDA and Justice and Aging with their upcoming report, but also baked into the legal services recommendation. So thanks to the legal services group for that.
Thank you, Bertha. Our Justice and Aging team has been incredibly instrumental, and our partnership is they're just amazing. I don't have the words to describe, but yes, we're working closely with them, and we'll have something to report out to in the fall. So look out for that. Vivian, did you want to add to, or Susan?
Just thanks, and I really appreciate these big council meetings because It's just great to hear everyone make connections and point out where we can be working together to, be more efficient and share resources. So I'm really excited about that. But I want to pass it on to Marty because I know Marty wrote a really great response in the chat, and I think it's worth for us to hear it.
Hey, Vivian, thank you. I like good reviews. Marty Emoto, I'm a dad of a 32-year-old with Alex is his name, with Down syndrome, autism, behavioral health needs, and also a family member. My little sister had developmental, physical disabilities and behavioral health needs. First of all, I want to thank, and also CDCAN, California Disability Aging Community Action Network. I just first want to thank all the subcommittee chairs and the subcommittee members for the incredible work and the presentations. It was really good. I just want to add, and I mentioned this in the chat to Achilles, and I appreciate Achilles your report and your response back. But just to underscore, and this is something Tony Anderson has mentioned too, and if in part of our work in making these changes and being responsive, if we can just really do everything we can to mention the agencies or the people that other people connect to. So when I see this, I know that regional centers are included or the state council. I know that, but I don't see them. And the broader population out there will look at what we do here and see no connection to all the good work that all the subcommittees have been doing. People need to see themselves in what we do. And I've been involved in this system all the way back 50 years, much longer than many of you. But I don't see my sister in the work that we're doing. I know it's there. And I know that that is the goal of all of us together. And I don't question the intent of anyone here. But let's please remember that people look in what we do and to see if they're there. And so if you have an agency like the regional centers or state council, or it could be IHS, whatever it is that people identify with, then they might believe that, yes, this is about me. I can say from experience with my sister when she was alive, and she was an older Californian too when she died. She was in nursing homes and all that. There was abuse going on, and my sister and my family fell right through the cracks and nobody helped us. And I'm just going to say that from personal experience, that's still happening. And I just want to make sure that we do everything we can together because we're doing incredibly good work. I mean, Vivian, I want to do a shout out to all the chairs and to the subcommittees. You guys are doing incredibly good work, but let's make sure we're touching the people that all of you want to help as well. Older Californians, my sister was an older Californian. She had developmental disabilities too. And we have a responsibility to older Californians who have disabilities. I don't want us just to say it at the beginning of the meeting and don't address it into specific things that we do. I'm going to be very fierce about that. So I want us to go out of our way to mention all the agencies that serve people with developmental disabilities, people with physical disabilities, and people with behavioral health needs. Because if we don't do that, then we're not serious. Okay, we can't talk about addressing people, doing things that are, in terms of accessibility and all that, but we don't mention and allow people to identify that, yeah, this is a part of us. So I'm done with my rant. I got my coffee. I do want to end this saying thank you, because honestly, I think you guys are doing tremendously good work. I mean, I'm a part of it, but I really appreciate like Bertha and Susan. You guys are, this is awesome. But I just want to mention these things so that we don't forget. Thank you.
Thanks, Marty. And I'm really glad you brought that up because it actually leads into some information that we can share now. So the equity team at CDA is working on an aging and disability lived experience advisory board. So there will be more information about that at the day of action, but CDA is specifically working on bringing in those voices of people with lived experience so that they're really highlighted. I will also say, I don't think there is any representation on the council right now from stakeholders who work with the regional centers. Maybe that's or maybe we need more representation, like from people who are working at regional centers currently. um
Vivian,
Sorry,
you mean on this council?
I'm talking about on this council, like you mentioned the regional centers. Do you think
Oh, I
that we
mean,
need to
Tony
have
Anderson
some additional?
actually is
Oh,
representing.
sorry, Tony's here, but do you think we should have some additional representation? It feels like from your comments that you feel that there's not, this isn't being brought up properly at every meeting. So I wanted to know,
Oh,
do you
thank
think
you.
that do you need some additional representation or something else? If you have any ideas.
Yeah, and I'll send that to the rest of the council, some ideas but I really appreciate your response, Vivian. You've been really, fantastic in responding through all these meetings when we raise issues. So thank you for that.
Yeah, go ahead, Tony.
I would just add that there are a lot of the slides and when Marty was talking, because we're on the committees, we know that we're being included because we're part of those conversations and we talk about people with disabilities. But what the slides don't mention, right? They don't mention it, people with disabilities just in general. A lot of the slides I notice, and a lot of our conversations start off that way. And I realize that it is the Department of Aging, but that was one of the criticisms early on about the master plan in general in the very early days. And was it really going to include people with disabilities? So I know people are very sensitive to that. And of course, I'm always listening for that. It's my role on the committee is to make sure that there's a place for people with disabilities, people with developmental disabilities in particular. So that you may not feel like we're being excluded, but it just feels that way sometimes because the slides don't say it. So, and Aaron's on here too, so there's three of us directly from the DD community that are part of this.
Yeah.
Heard, and I really appreciate it. And I think that um, it's really nice to have this committee be an open space where we can, take criticism and try to become better. And so I really appreciate that. And we're going to make sure that we integrate that into the slides and our work going forward. So thank you for bringing that up.
Yes, thank you. And I also just want to take a minute to, I know Aaron's on this call and individuals from his State Council on Developmental Disabilities have been so active in the conservatorship subcommittee and being there to represent and give that feedback. Also, I think, as you said, we're not always as explicit because a lot of times when some of us are doing the work, for example, in our legal services, we serve both adults with living with developmental disabilities, their caregivers, and older adults. And so sometimes we're used to working in an umbrella format, so we are not as nuanced as when we call out those different experiences. So again, thank you for mirroring back the importance of staying true to our equity principles. And I think that just to speak a little bit more, I know Jackie might get into it, but I was really appreciative of the work that the tool that was created by Jackie and the Master Plan on Aging had us do in the subcommittee works, because it really asked us not to just say what's the recommendation, but what's the problem statement and what need is it going to cover, so we could dig deeper into that. And you're right, part of the when we say public guardian or when we say coordination of APS, as people that work in the field, we might understand how IPS shows up for an adult with intellectual disabilities. We might understand how public guardian shows up for an adult with mental health issues or an older adult living on their own, but we don't, the public doesn't, right? And continues to be a hurdle in terms of information and how we continue to bring visibility and meaningfulness to what those agencies are doing so that it has a direct impact on all the different type individuals that we're trying to assist. So thank you again for those comments. Lisa?
I just wanted to kind of piggyback on what you're saying, and I think a lot of it is a question of awareness. CEJC is currently spearheading a study on conservatorship in California, as most of you know, and the Judicial Council has asked us to look at limited conservatorships. And I have to say, I've worked in aging and have dealt with conservatorships my whole career, but really knew very, very little about limiteds. And so, I think I'm not, I think we certainly need to have that voice in the study so that we understand where the gaps are. And so that, we're talking to each other and also like providing each other with information about opportunities that if, something like this is happening, that this would be important for, to have input from the regional centers and the disability rights community.
Yeah, I think it's important, Lisa, like you said, when we do something as we go back into our groups and further refine the recommendations, that we think about how different groups experience different agencies, and that goes into strengthening the agencies and the ultimate like infrastructure, right? Like I know sometimes a lot of individuals that are, I'm going to use a word from the regional centers, consumers of regional centers, sometimes they, once they're in different systems, it almost feels like a game of tennis that they experience. Like, no, call the officer of the day at the regional center. No, call APS. No, call the probate investigators. And so, again, I think, although we can be more explicit in how that's being done, I think going back to the reflections from what the council has done this year, and maybe we should, probably Aaron and Tony, you'll be hit up next for a listening session. But one of the things that we were able to do was have that we reported on last time was have a listening session with Rebecca May from the Professional Fiduciaries Association. And also, I just want to, again, shout out Aaron from your team, as supported decision-making has taken off. They've been giving us a report on how that's happening, on the funding opportunities that are happening around that, so that we can all understand that there are gaps, that there are being experienced differently. And while we're looking to create coordination for one group, we need to understand how everybody else experiences it how the different groups experience it when they come through the door, like whether it's somebody that's conserved, whether it's somebody that's living with different disabilities, and then sometimes can be ping-ponged. So that's an important reminder as we go back to refine our recommendations.
And it looks like we have about 2 more minutes before we have to move on. So if anyone else has any other comments or questions, I believe Director DeMorris just put a link in the chat for anyone who's looking for information on, let's see, the California Department of Developmental Services Master Plan for Developmental Services. There's a link there. And also, not to put Lisa on the spot, but I'm hoping that when your report is done, you can maybe give us an inside scoop on the findings that your organization has made about all of the types of conservatorship in California.
Absolutely.
Thank you, everyone. Thank you for your hard work, dedication, and your role with EDJCC. Your efforts really impact our initiatives in advancing, elder justice and our most vulnerable communities. So I want to shout out to our EDJCC subcommittees, members, stakeholders, our chairs. And at this time, I'll go ahead and next, we'll move to our next item on the agenda, which is the Master Plan for Aging. And I would like to introduce Jackie Tompkins, our Master Plan for Aging Project Director with the California Department of Aging. Jackie, I'll go ahead and hand it off to you.
Greetings, everyone. Good morning. So wonderful to hear the recommendations from the various subcommittees of EDJCC today. Susan shared in her opening remarks that we are going to be collecting these recommendations from the committees, the MPA stakeholder advisory committees. These will be submitted to the Department of Aging, but they will also, as Susan alluded to, be shared with our state partners, different agencies, administrations, departments, as we have seen through today's conversation, as well as other conversations, that the issues that we're talking about are cross-cutting, intersectional with our MPA program partners as well. So in addition to hearing a bit about what the subcommittees have been working on, recommendations that the committees are putting forth will be highlighted and elevated at the California for All Ages and Abilities, our 2024 NPA Day of Action happening this fall. Hopefully, I think I joined all of you back in May when you had your second meeting of the year, and I was able to walk through some details of this particular event. We have some more information to share with all of you today. Hopefully, all of you as EDJCC committee members are already registered for the day, but if you're not, this is going to be a special plug to ensure that you do get registered to join us. I checked today, and we're looking at about 704 people attending this event. Right now, because it's virtual as well as in person, we have, of the 704 people joining this event, we have 418 that plan to join us day of in person at the Safe Credit Union here in Sacramento, California on Tuesday, October 8th. Do want to also always thank our NPA philanthropic partners for supporting this event and allowing us to have the resources to pull together an event that really is designed to elevate the voices of stakeholders, consumers, those with lived experience, and enable not only, again, the California Department of Aging to hear it, but also our sister departments, agency, administration, and legislative leaders as well. So I'm going to take just a moment to walk you through some highlights of the Master Plan for Aging Day of Action this fall. Callie, I might have you hit one more because I think there's just one more bullet point there. So just try to give you an overview of what to expect for the day. Some of you might have been able to attend the 2022 event. That was the first time we were able to host the MPA Day of Action, and we are here in 2024 looking to host another event. So really, this event is geared towards hearing directly from our MPA stakeholder committees, as well as the additional consumers, those with lived experience, about the highest priority issues that Californians are facing, older adults, people with disabilities, and their caregivers. This really allows us to ensure that California's Master Plan for Aging remains responsive to new information, different resources, subsequent priorities. So while the Master Plan for Aging is still grounded in our 5 bold goals, we do rejuvenate, refresh our priority initiatives every 2 years. So again, this is the time where we're going to hear those recommendations and be able to further center our work on equity and lived experience. Second, it's also a time that we can highlight the progress to date that we've made collectively as a state. Again, this is a whole of government, whole of society, whole of community approach. We're at that mid-year point with California's Master Plan for Aging. So I think it's really important that we are able to reflect on the progress and the success that the Master Plan has had to date, but then to also acknowledge that there are still issues, priority topics that we still need to tackle. And what does that look like? So again, it's that opportunity to reflect, but also reinvigorate our commitment to the state's Master Plan for Aging. I shared with you that we're looking to bring diverse partners to the Day of Action. Again, the MPA stakeholder committees, consumers, public members. We have also, again, invited our state partners and even national leaders to engage in the conversation, again, embracing that whole of government approach. So those are essentially the meeting aims of the day. So going on to the next slide. We are still working on the agenda, and we're hoping to have that available on the event website shortly. But I just thought it would be a good opportunity to share with you of what we're looking to have at the Day of Action. First off, acknowledging the importance of embedding equity throughout the Master Plan for Aging, and again, hearing from consumers of services and programs. We're looking to pull together a panel of consumers and community members, those with the lived experience, to talk about not only maybe challenges with navigation, access, affordability of long-term services and supports and home and community-based services, but then to also talk about some of their stories and successes in navigating such services as well. So we're going to start the day with a consumer panel to, again, ground the day in the why we do this work, why it makes a difference not only at an individual level, but a community level, a population level. This is also that day that we're going to hear from your committee. We're going to hear again from EDJCC. We heard a little bit sneak peek of some of the priorities that are coming from this particular stakeholder committee. Those priorities are going to be turned further into recommendations that, again, will be a part of the input process to guide the next iteration of the Master Plan for Aging initiatives. And then this will also be an opportunity that we're going to hear from state leaders, again, recognizing that we want to talk about the progress, priorities, and recommendations. And we're looking to invite state leaders that really address the topics that we have in the master plan, such as housing, healthcare, transportation, et cetera. So looking to bring in diverse leadership, multi-sector engagement from our state leaders. And then looking to round out the end of the day by opening up and having a conversation with some of our policy and budget staff within the legislature and the administration as well on how we can further advance systems changed with the Master Plan for Aging. We do have a number of networking and breaks during the day, including a post-networking reception following the event. So again, hope that you are all able to join us for that day. And then I think I have a couple more slides to walk through. Oh, I walked through that really fast. So maybe I will just open it up for any questions that you might have as committee members. I do know that we will be conversing with each of the MPA stakeholder committees in a little bit more detail about the roles and responsibilities of the committee members on that day. For those of you, again, who maybe attended the 2022 event, there was a time that at the beginning of the event that committee members were introduced as a group to the attendees. There's an opportunity to do that again this year. But again, also an opportunity for the various MPA stakeholder committees to verbally share their recommendations to the attendees. We do plan to also have your recommendations posted on the event website, as well as be available as a handout at the event as well. So further details to come on that piece is probably not as much as you wanted today, but I did want to keep the doors of communication open relative to the event to field any questions, because I looked at the calendar and I said hooray and yikes at the same time when I saw that we are 2 months out from the big day here in Sacramento. Last fall seemed like a long time a couple months ago, but here we are 2 months out to really an exciting event, an important event, one that's really going to help shape the Master Plan for Aging for the next 2 years and essentially beyond as well. So I am going to take a moment, field any questions that you have, committee chairs or committee members.
Jackie, I just wanted to take a moment to thank you for all the work you came into each of our subcommittees, really helped us hone in and start the hard work of coming with the recommendations. And I know that you created tools for us to really kind of be able to dig into them. So thank you. I also just wanted to say that I really appreciate the format of the Day of Action that allows people to attend in person, but also consumers virtually. And I would just encourage all of us to amplify those opportunities for stakeholders. And I don't know, I've been thinking of ways of how we can, I think all of us want to make sure that people that are experiencing the systems are giving feedback on what we're talking about. So I would just say maybe if you have client stories that you want to bring with the Day of Action, or if you want to encourage different community partners that work more closely related with individuals, or publicize it to make sure that people have the opportunity to feel included. And like you said, being heard matters and being able to share your story matters. And thanks to the day of action, it really is the format makes it welcoming to be able to do that.
Great, Bertha. I'm pleased to hear that you found the resources helpful, and my drop-in meetings to the subcommittee meetings also helpful. I know I was asking like a lot of questions, but I think when we're tackling issues that are so complex, it's really important that we ground ourselves in that. What is the problem, the essential foundation that we're trying to solve here, and have some consensus around that, and then allow the solutions to really support that that identified problem. Hi, Lisa.
Hi there. I seem to always be piggybacking on to Bertha, but just actually, I think it was Vivian was talking about how important it is, or be a priority for the legal services group to engage more actively with the Attorney General's office. And I don't think we've seen an agenda yet for the day of action, but I'm hoping that the Attorney General will be there. And that would be great if, we could somehow find ways to make sure that he heard our suggestions, or somehow had opportunities to engage, or, somehow use this opportunity to elevate our interest in working more closely with the AG's office. So important. And not just, I don't think it's just for our committee, but other committees as well.
Appreciate that feedback and interests that this committee has relative to the state participation to have at the event. Thank you, Lisa, for elevating that.
Also, Jackie, there is a question from Tony in the chat about, it says, are we meeting and coming in together like we did in the past?
Yeah, that's kind of the vision that we have right now, Tony, is having the committee members with support of the CDA staff who supports the committees be able to introduce and share the stakeholder committee members in that kind of entry format. That's essentially it mirrors the 2022 event, that we will be able to acknowledge not only the work of the various MPA stakeholder committee members, but also show that consensus, that that group process through that entry activity as well. So hopefully that answers your question, Tony. We're still kind of, like I said, working on logistics and the flow and timing, but please plan for that to, be there first part of the meeting. There definitely will be time for networking and breakfast in the morning, but then we would value committee members coming together and then joining us in the program, doing that kind of celebration, walking into the event space. So thank you, Tony. Other questions about the particular event?
Will there be a cutoff date, Jackie, to registration for online or in person that people should know about, just so that people can prioritize it on their calendar?
Yeah, thank you, Bertha. We are coming up on hitting our maximum for in-person attendance, so please get yourself on that list if you're not already registered and you want to attend the day of action in person. So that we will have a wait list coming up. There's definitely some spots still available, with only 418 are registered in person right now. But even morning of the event, people can register for the virtual access. I see a question from Liz. Your hand is raised.
Yes, I remember that there was an email that explained this, but when we're registering, what is our registration type? Stakeholder committee member, correct?
Yes, when you
Okay.
register, drop down, I believe it says appointed MPA stakeholder committee member, and that's the one you want to select. In the event
Great, thank you.
You don't select that one, we'll shift you over on the back end, but that would really help us, Liz. Thank you. All right. So absolutely, I'll be in further contact with all of you in collaboration with Rajna to communicate out any additional specifics. Again, we're 2 months out, so we're really getting to that crunch time space. But please know definitely a role for EDJCC at that event to elevate your priorities. And just know that I'm available to field any questions that you have in the interim, but we will be able to describe a little bit more of your envisioned roles and responsibilities at the day as we get a little bit closer to the event. Appreciate the time on today's agenda. I think we might be a little bit ahead. I don't know, Rajna, if you want to do, I think right now we were slated for a 10-minute break. Are you thinking maybe even a 15-minute break to allow more stretching? I will defer to you on what makes sense.
Absolutely. We can take a 15-minute break. But Jackie, before we do, I want to thank you for the valuable information. I know it's really helpful as we move forward with the Master Plan for Aging Day of Action. And thank you for the MPA team for all of the work that you're doing surrounding this. I know it's a big lift, so we really want to acknowledge that and echo Bertha's sentiments as well.
Appreciate it. You all make it easy for us. It's good work. Right. So how about we plan, if we're looking at maybe a 15-minute break, do you just, Rajna, what makes sense, 11:45 or I was thinking of kind of rounding off the numbers.
Absolutely. Let's come back and reconvene at 11:45.
I think we're ready when you are.
Perfect. Thank you. At this time, I'd like to welcome Consuelo Gambino, our Tribal Affairs Manager from the California Department of Aging. Consuelo has been instrumental in deepening our engagement within our tribal partners, ensuring that our programs and initiatives are inclusive and responsive. So at this time, I'll go ahead and hand it off to Consuelo.
Thank you, Ranjana. So hello, everyone. My name is Consuelo Gambino. I am the Tribal Affairs Manager at the Department of Aging. Thank you for allowing me to attend your meeting today and provide you with this presentation. So please move forward to the next slide. So in this slide here is some demographics. There are 109 federally recognized tribes in California. And this image here is a visual representation of all of the tribes in California. There are quite a few in Northern California as well as Southern California. Most are in rural areas, and then we also do have many that are in the urban areas. In California, there are a little over 920,000 American Indians or Alaska Natives whose race in combination with one or more races. And then of this group, there's a little bit over 360,000 that reported their race as American Indian or Alaska Native alone. Next slide, please. So in this slide, so of this group, there are older adults, the tribal older adults in California. The most populated areas are going to be in the urban areas. So Los Angeles County has the highest number of American Indians, Alaska Natives, older adults, and then followed by San Diego County, San Bernardino, Riverside, and Orange County. So of this group, 55 to 59 years of age, there are 56,607 older adults, AIN older adults in California, and then followed by the rest of the numbers. So please, next slide, please. So part of the Older Americans Act in 1978, it was amended to include Title VI, which created nutrition and supportive services for American Indians, Alaska Natives, and Native Hawaiians. And in 2000, services were expanded to include caregiver support services. And then recently, in March of this year, the Older Americans Act published new regulations, which encourages coordination between states, state departments, agencies, and the area agencies on aging to support and expand, hopefully expand services for our tribal older adults in California. Next slide, please. So the Older Americans Act Title VI, the Administration for Community Living, ACL, directly awards eligible tribal organizations and tribes grants to deliver home and community-based supportive services, which include nutrition also, and support for families and caregivers for American Indians, Alaska Natives, and Native Hawaiians. So instead of going through the area agencies on aging, they receive funding, federal funding directly to them. And part of the funding requirements, tribes and tribal organizations must represent at least 50 Native American elders aged 60 and over within their service area. And then once funding requirements have been met, tribes and tribal organizations have the flexibility to adjust those age requirements based on what they consider a tribal elder. And a lot of our tribal communities consider age 55 to be an elder. Next slide, please. So these are the current Title VI tribal grant recipients. They are spread out throughout California, many in Northern California, some in Central and Southern California. And we have recently developed a formal introduction letter, which was sent out on behalf of our director, Susan DeMorris. So we have sent formal introduction letters to all of our tribal grant recipients, formally introducing the Department of Aging, our director, and also highlighting the MPA Day of Action and inviting them to attend the Day of Action. We really would want to hear them, hear their voices, and have encouraged all of them to attend the event as well. Next slide, please. So the California Tribal Consultation Policy Executive Order. This was first established in September in 2011. All states, state agencies, and departments are encouraged to communicate and consult with the California Indian tribes so we can hear from them. We can hear their input in regards to legislation, regulations, rules, and policies. So this is something that we are kind of moving forward for the Department of Aging. We would hope to see this in the future to have a consultation policy or a tribal engagement plan. So more down the line. Next slide, please. We've researched some key elements of tribal consultation policies. We've connected with our sister departments in the state, the Department of Social Services and Department of Healthcare Services, to learn more about the tribal consultation policies and further research and develop one for the Department of Aging. And some common themes that we've found are each policy has an introduction, a background about the department, highlighting the executive order, and some definitions that are specific to AN communities. And then also what would be unique for the Department of Aging is we could create our own guiding principles, values specific for our department. Next slide, please. So some initial steps we have done moving toward a consultation policy is we have developed a survey for our area agencies on aging. It's a brief survey for us to learn more about their engagement with tribal communities, tribal organizations, tribes, some of the programs that they have for our tribal elders, and also to learn more about any available resources and materials, and also how the CDA can provide support. So this survey has recently been released, so we're very excited that it is out now, and we are looking forward to learning more by the end of this month and continue to move forward toward that engagement with our tribal communities. So next slide, please. So some tribal engagement events that we have attended in the past and some upcoming ones. Our director, Susan DeMorris, attended the California Tribal Nations Summit in February. And I also attended the Honored Elders Day in June, which is this picture here. I shared a table with the Tribal Affairs Office at the Department of Healthcare Services. So a great event out in the community. Also upcoming is a Tribal Leaders Forum in September and the California Native American Day in September as well. And we will also share a table with the Department of Healthcare Services at this event. So I encourage all of you to attend the Native American Day in September. It's a great event. A lot of state departments and agencies will be in attendance. So a very wonderful day to be part of. Next slide, please. So this is my contact information. If anyone has any questions or wants to learn more about some specific things, please feel free to reach out to me directly. I am available and I'm always eager to learn more and how I can provide support. So I will go ahead and see if there are any questions that you have right now. I'd be happy to answer or anything that you want to discuss as well. Thank you.
Does anyone have would anyone like to ask Consuelo any questions at this time?
I can start. Thank you, Consuelo, for this really great presentation. I'm just wondering, what do you think you'll be doing with the survey results once you receive them on the AAAs?
Yes, so we definitely want to learn more about the current tribal engagement. What I mentioned earlier about the Older Americans Act, the new regulations, we want to build that bridge between our tribes, tribal organizations, and the area agencies on aging. So we can connect our tribal elders to them and, vice versa with each other. We want to support our tribal elders within the community, within California. So our initial first steps is to learn more about tribal engagement and see how the CDA, how we can provide support.
Thank you again. Thank you again, Consuelo. I was just wondering, is it possible to go back to that slide that shows where the different tribal communities are in California? I was really taken aback about how in Los Angeles there's such a high concentration, but when I reflect on the services that we provide, I don't see that being reflected in the population that we're serving. So that was very helpful. Thank you for that.
Yes. So there are, of course, the urban areas are a lot larger than other areas in California. But yes, the highest population for tribal older adults are in Southern California. So just going back to this image here, there's many tribes in like San Diego County, Los Angeles County, or I'm sorry, not Los Angeles County, but a little further down. On the east side as well. So it just kind of, varies where people reside. If some reside within their home community or others have, moved to more urban or reside in urban areas. Yeah. Thank you. And I see a hand raised by Aaron.
Hi, Consuelo, Aaron Carruthers from the State Council on Developmental Disabilities. Thank you so much for the very helpful and informative presentation. It had a lot of nice foundational information as well as really good specifics. I was curious to ask you or the organizers of this meeting if they'll be sharing your PowerPoint.
Yes, absolutely. I am happy to share the PowerPoint, and I think Ranjana may have a copy, but I'm happy to forward that also just in case.
Yes, the meeting materials will be posted on the Cal HHS website in a week or so. So all the materials will be posted.
Okay. Let's see if there are any other questions. I don't see any hands raised or in the chat.
There was just one comment. It's just from EDJCC panelists. I'm not sure who made the
Oh,
comment, but they were highlighting the International Association of Indigenous Aging. I think they go by IA squared, and that they're working with tribes on elder justice tribal codes. And I do actually know some people from there. So if you're interested in connecting, Consuelo, let me know.
yeah. Yes, absolutely. Thank you. I would appreciate that.
Thank you, Vivian.
Okay. I'm not seeing any other questions or hands raised. So, oh, I see one more actually. Bertha, please go ahead.
Sorry, because I was wondering, would you be willing to share? That was such a great action that the CDA took to proactively reach out and invite the different councils to the day of action. Would you be willing to share that contact list with any of them so that the rest of us in our own separate roles of organization can make sure to include them in other outreach events?
Yes, sure. I am happy to share that. I can forward that on to Ranjana.
Thank you.
Mhm. I also wanted to mention too, in the introduction letters, we also noted their respective area agency on aging within the letter. So further connecting them to their AAA and kind of building that relationship or continuing to establish that relationship. So
Thank you, Consuelo.
thank you. I'll pass it back to you, Ranjana. Thank you, everyone.
Thank you for sharing your work and ongoing commitment for our tribal engagement with our tribal partners. It was great learning more about all the progress we're making here at CDA. Thank you. Next, I think we are ahead of our scheduled agenda. So what we will do while we're waiting for our administration for a community living partner, I believe Sarah Steenhausen will give us a little update on the new advisory board for, the Aging and Disability Lived Advisory Board. Take it away, Sarah.
Thank you so much, Ranjana, and just a huge appreciation to the members of the Elder and Disability Justice Coordinating Council. I'm amazed at the work that you all have been doing in between all the full committee meetings. Tremendous leadership. Thank you, Berta, and all the subcommittee chairs, and of course, Ranjana, for your work in staffing all of this. It truly is what makes stakeholder engagement meaningful, is when you all do the hard work of coming to consensus on the key priorities. That's what makes these sorts of councils and stakeholder engagements meaningful. And I recognize that you all have full-time jobs on top of it. So, recognizing that there has been, a lot of input about the need in the master plan for aging to not only embed equity throughout the master plan, but also to elevate the voice of the person in all that we do. And, I think for many years with stakeholder engagement, it's easy to assume that when you have stakeholder advisory committees, you're hearing the voice of the consumer. But we've seen more and more the importance of actually engaging people with lived experience to inform policy, to inform program, to raise awareness about issues that we might not hear about at the state level. This is also something that's really critical to the Health and Human Services Agency, is making sure that everything we do, one of our key principles is embedding the voice of the person in all that we do. So to that extent, we have been working really closely with our Equity Advisory Committee on Aging and Disability, which is one of our key master plan advisory committees, which, yes, next slide. Thank you, Jackie. Next slide. There we go. To think of how we might stand up an Aging and Disability Lived Experience Advisory Board with the goal of embedding the voice of the person and the consumer in all we do, and really looking at how we might develop a partnership with our Equity Advisory Committee to help guide that work, to help frame that work, and then to determine how we can use the work of the Lived Experience Advisory Board to inform our other stakeholder advisory committees. So this is a concept that we started putting together earlier this summer. And if you want to go to the next slide, we have an approach where we are looking at standing up. We have some resources to support this effort. We're very fortunate to have foundation support from our Master Plan for Aging Foundation partners. We've hired through the support of the Master Plan for Aging Foundation partners, we have a consultant from the Mandela Change Group to lead this work. Maya Sandoval is tremendous background in this area and is helping us think about how we might stand up this advisory board. So what the concept is that the Lived Experience Advisory Board would work closely with our Equity Advisory Committee on Aging and Disability, and they would help us facilitate those conversations. And we would essentially use the engagement of our Lived Experience Advisory Board to inform the work of our other Master Plan for Aging stakeholder advisory committees. So for example, there may be an opportunity to explore some of the issues that are really critical to the Elder and Disability Justice Coordinating Council, as an example, and really understanding from their experience what their perspective is. So at this moment, what we're doing is we are working with the consultant to convene members of the Equity Advisory Committee to help develop the framework and the parameters of the Lived Experience Advisory Board. Of course, it will be really critical to think about membership representation, ensuring that we have representation from all of the communities across the state that we want to make sure to reach, and that we have a process for facilitating their engagement that is person-centered, that's equitable, and that's accessible for them, whether it be regarding language access or whether it's about accommodations that are needed for their support. So we are just beginning on this engagement, and we hope to have this Lived Experience Advisory Board stood up sometime in the early part of 2025. Next slide, please. If there is a slide, there we go. So with that, we have secured our support of our Master Plan for Aging Foundation partners. And we're working, as I said, with the consultant Maya Sandoval from Mandela Change Group. Continue to engage the Equity Advisory Committee on this. And then we anticipate the launch, most likely, I would say, probably somewhere between February and May of 2025. So with that, I'm happy to answer any questions, but looking forward to keeping you all updated on the progress towards the Lived Experience Advisory Board.
And Sarah, if I might add too, Maya, who is the consultant for this work, will be joining us at the MPA Day of Action as well. So she'll be able to also hear the priority areas that EDJCC represents. So just wanted to highlight that. Again, we're working with the Equity Committee as well as staff here at CDA to essentially develop operating framework. But we also acknowledge that once those members are identified that will be part of the advisory board, is we will also want to ensure that they have an opportunity to weigh in on the framework and the operations of the advisory board, as it will be critically important that it works for all parties involved in the process as well. So we're kind of developing that framework with the Equity Advisory Committee on Aging and Disability, but definitely those who are involved in the advisory board, once confirmed, will have opportunities to weigh in and also provide feedback and other contributions.
I see a question from Tony. Hi, Tony. Question is, the Equity Advisory Committee on Aging and Disability connected with the California Racial Equity Commission in the governor's office. So my understanding is there's no direct connection. You know, our Equity Advisory Committee was initially stood up as an equity work group that helped inform the development of the master plan for aging. But then with the launch of the master plan for aging, we're able to formalize the role of the equity work group into this equity advisory committee. That said, our equity officer, Marina Castillo Augusto, really is doing a lot of work to make sure that she's closely connected with all the different efforts across the state and at the governor's office and Health and Human Services Agency. So, oh, I see a question from Lisa. Hi, Lisa.
Yeah, it's not really a question. I just wanted to mention the Secretary of the Interior, Deb Haaland's project to interview survivors of boarding schools that's taking place around the country, which is a really fascinating project. And if there's any opportunities to, I don't know, coordinate or just learn from that project, I think it would be worth doing.
Great. Well, thank you for that recommendation and for sending forward any information. Okay, well, I don't see any other questions or comments, but thank you again for all your great work. Back to you.
Jackie, it seems like our partner is still not online. Would you like to move forward with public comments?
Sounds good. Callie, if you're able to bring up the slides related to public comment instructions, that would be most helpful. So we're going to take about 10 minutes to do public comment at this time. Again, attendees joining by phone, press *9 on your dial pad to join the line, and we will announce the last 4 digits of your phone number and to unmute your line. If you are a public member and you're joining via Zoom, click the raise hand button to join the line, and we will also announce either your name or the last 4 digits of your phone number to unmute the line. As a reminder, public commenters will have 2 minutes for each of your comments, and I will probably give you a heads up if you're getting close to that 2 minutes, so we're able to allow additional comments to come in. In the event you want to provide additional comments following this meeting, you are always able to email us at engage, ENGAGE, at aging.ca.gov. So I'll take a moment to look at the attendee list and see if anybody has their hand raised to do public comment at this time. Waiting a little bit of time so people can formulate their public comment. Definitely don't want to cut this public comment period short. So we will hang out for just a little bit longer to make sure we capture any feedback or input that is coming in from those joining us. I am not seeing any publics coming in. Oh, we got one right here. Jessica Kramer. I'm going to activate your line so you can talk. Please unmute yourself.
Hello, everyone.
Hi, Jessica. Hi, Jackie. So my name is Jessica Kramer. I am a living experience, meaning I didn't just live it, I live it every day, both personally with my own set of disabilities, as well as a vocal advocate for seniors and people with disabilities. I founded a project um, called Reach SD Senior and Disability Advocacy. It's a nonprofit project, and we're active in San Diego County. We do a lot of law enforcement policy work around the senior and disability victimization policies that came from Senate Bill 338 and the Senior and Disability Justice Act. I've watched well, not watched because I have a vision injury right now, but have listened to this meeting. So I've listened to all of the past meetings. I feel like this group is the most informed and incredible group of people coming together and conversing about the issues that have most deeply affected my life and the people that I help. I'm also very engaged in dependent adults experiencing homelessness, although we are trying to get away from the dependent adult the dependent adult terminology because it's so ineffective for law enforcement and for the community. I still use it just so that everybody is on the same page about what we're currently dealing with when it comes to policies. And I'm so excited to keep engaging. I know I only have 2 minutes, so one of the first things I want to say is that it is very confusing that the sorry, the acronyms are still hard for me, but oh my gosh, the whole thing that this, sorry, oh gosh, my brain. Jackie, could you help me? Oh, the master plan on aging. Okay, so the master plan on aging absolutely should be the master plan on aging and disability by name because it is totally misleading. It threw me off for the first 2 meetings that I watched. And then I began to realize that this is meant to be an equal senior, equal disability council. And I know by best practice under the Senior and Disability Victimization Act, one of the strong recommendations is to never abbreviate elder abuse and to always say elder and dependent or elder and disability. So I'm just going to really ask moving forward. I've heard some other wonderful speakers today mention it, but it's just so critical because part of why the community feels marginalized, the community of people with disabilities, is because elder abuse has become so catchy. It's so marketable. It's so easy to say. It's so easy to write about. But when you start adding the longer terminology, it gets a little bit more confusing. And when you Google anything that has to do with elder and dependent adult abuse, especially legal services, you will find very heavy information on elder. And then it's almost like the dependent adult or adults with disability abuse is like reading the fine print. And then also I heard somebody comment about vision and other sensory impairment, which I am navigating. And I am so committed to participating in this group that I will overcome any obstacle, but I can't imagine other people having the will or the ability to engage with similar disabilities. So thank you very much all for what you're doing, and I look forward to being involved more in the future. Thank you, Jessica, for your engagement at today's meeting, as well as providing that public comment. Appreciate your time today. Any other public comments? Again, I'm okay with waiting just a moment to again allow for this valuable opportunity for you all to provide your input and feedback. I think we can move forward on our agenda.
Thank you, Jackie. I still don't see our Administration for Community Living partner, but if the EDJCC chairs would like to discuss any other additional items, we definitely have the time to do so.
I think now would be a nice time because our council is so enriched by all of us doing different work within our own agencies. if people are willing, if we could just go around and talk about an update from our agency, that would be beneficial for the whole group to know. For example, Vivian, if I can turn to you, I know Vivian and her colleagues at Justice and Aging just released a great brief that was sent around on the Engage website. And I was just wondering, Vivian, if you can give, if you wouldn't mind giving a high level profile of that article and what might have prompted it.
Yeah, thank you, Berta. So we just released through the National Center on Law and Elder Rights an issue brief that I co-wrote with three of my colleagues, and the title is How Can Legal Assistance Providers Better Meet the Needs of Black Older Adults? So we really go through all of the ways that certain legal issues impacts Black older adults in particular. So, for example, issues of tangled title and probate issues. In particular, another really interesting part that I helped research was finding out that about 77% of Black people don't have a will. So a lot of Black older adults don't have any kind of estate planning, which really impacts their ability to preserve wealth, like through home ownership, through the generations. So I can find the link and put it out in the chat for everyone if you'd like to read it. I think it would be helpful even if you're not a legal services attorney to read that. And we also did a presentation, a roundtable presentation on this issue at this year's ASA conference in San Francisco. And we got a really good amount of feedback. People were really interested in talking about the ways that elder justice services serve Black older adults and how we need to have a nuanced approach for Black older adults because of the issues that this community specifically faces.
Thanks, Vivian. I just want to say again, there's it's funny how even though we're all working separately, kind of as issues bubble up, we all tend to end up working on some similar things. At BETCETIC, we launched a Leaving a Legacy program because exactly of what Vivian noted. We noted that a lot of our clients through elder independent adult abuse, when they were at risk of losing their housing, or were subjected to more invasive proceedings such as conservatorship. It really was the lack of advanced planning and the access to it, and also the myths around advanced planning and who it's for. A lot of individuals connect estate planning with wealth management, and that's simply not true. Right? Everyone has something that they can plan for. Everybody has the right to make their decisions. And that includes now with the great work of supported decision making. I might call on Erin next to give us the update on the SDM TAP program. But I know at BETCETIC, we're looking forward to developing a prototype for supported decision making as well that will be interactive. And our Leaving a Legacy program just launched this year, and we're looking forward to the end report where we look at how when we were able to give feedback on exactly what is the picture of who accessed the service. And anecdotally, I can share that we really are, as Vivian's article so acutely notes, trying to solve a generational lack of estate planning, because a lot of older adults who might have been the former caregiver, they were the caregiver for their mom, are living in a house that grandfather or grandmother never probated, never put into a estate plan. And so now you have an older adult that is becoming housing insecure because they can't access any of the equity that's in the home because the home's not in their name. It's very hard to get private attorneys to take those cases because there might not, it can be very expensive because you're essentially doing two probates. So I never thought estate planning would be a social justice issue, but it is. And so it's exciting that the Legal Services Subcommittee that Vivian is chairing is looking into that, and look forward to further updates on that. Erin, can I trouble you for an update on TAP? I know that your team has done so much to make sure that supported decision-making, people know about it, people know about the viable tool, and really empowering older adults, independent adults, with the right to choose somebody to support them in making a decision instead of having somebody make a decision for them.
Yeah, thank you so much. Hi, everybody. Erin Carruthers from the State Council on Developmental Disabilities. And
hi, Erin.
My apologies. I don't want to interrupt. Your volume was a little bit lower on our side. I know we can make some adjustments, but just wanted to flag that before you gave your update.
Thank you for that heads up. I'll try to speak a little bit clearer and louder. How is that? Is that any better?
I think the second time you spoke was slightly better, still a little bit low.
Okay, helpful to know. It feels like I'm yelling on this end, so I'll, if you can adjust on your end, I apologize for whatever's happening on this end. Thank you for the opportunity to give an update about the Supported Decision-Making Technical Assistance Program. As you know, a significant portion of the dollars that the legislature gave for this program are for grants to give out to the community for credible, strong, good community partners to do different pieces of this work. And so the big updates is that all of the grants have been awarded and the work has begun on almost all of them. Just this week, we announced an award going for professionals, and it went to an entity that is going to provide training services for financial services entities, as well as legal and judicial services. Before that, we had announced grants that went to the California State University East Bay for doing work with educational services, legal services, and medical services, and they expect to reach 500 professionals through that grant. We announced an award for the Family Resource Navigators. They're going to be looking specifically at families and individuals, and will reach almost 3,000 people through their work. There is a grant awarded to Panya that will be looking specifically at individuals and families from Southeast Asian communities with a focused coaching approach, and will reach about 50 individuals in their work. And then finally, there is a grant to Disability Voices United, who will be doing a broad community outreach to families and individual participants, and will target and plan to reach 12,000 individuals through their work. So thank you for the opportunity to give an update about the program. The big update is the community grants are out.
Thank you, Erin, for that update. And for those that are interested in learning more, I placed the link for the program in the chat box. And thank you all for taking the time. Hopefully we can transition back to this at a future meeting, or if we have time at the end of the agenda for further updates. Back to Ranjana.
Thank you, everyone. Thank you, Bertha. I will now, I think Jennifer Baker is on from the Administration for Community Living. Jennifer, are you on?
I am. Hi, happy Thursday.
Perfect. Happy Thursday. Thank you for joining. So the final item on today's agenda is an important presentation from ACL. So I'm pleased to introduce Jennifer Baker, who will be presenting on the National Plan for Aging.
Thank you so much. It's so wonderful to be here virtually with all of you. I hope we have an opportunity to connect in person someday soon. My name is Jennifer Baker, and I serve as an advisor at the Administration for Community Living, where I have the great privilege to work with just incredible leaders across the federal government to be developing a national plan on aging. So over the course of the next 15 minutes, I'm just going to share some high-level details surrounding the strategic framework for a national plan on aging. So our first step in this process. Before I get there, I just, by way of background, want to share that I come to the table from actually not too far away from all of you all, from leading programs on the ground at the University of Nevada, Reno, and understand just, how important it is to be connecting with communities as we work towards the strategic framework and national plan. So I also most recently come from the Senate Aging Committee, and just really value the intersection of practice, policy, and programmatic expertise needed to advance really exciting efforts. So on the next slide, you'll see our pro-aging commitment. But before I dig into that, I'll back up just a second to say this work is authorized by the Older Americans Act through something called the Interagency Coordinating Committee on Healthy Aging and Age-Friendly Communities, which is a mouthful. And so we have abbreviated that to the ICC. And the ICC is now currently comprised of 17 different federal agencies, and we are charged with federal coordination and recommendations surrounding key aging issues that we'll talk about in just a moment. In August of last year, so nearly a year ago, Secretary Becerra designated Allison Barkoff, the senior official performing the duties of administrator at the Administration for Community Living, where I work, as the chair of the ICC. And so since that time, we've been digging in with our now 17 different federal partners and with some community partners that we'll talk about soon to think about what it might take and look like to have a national plan on aging and to leverage the ICC to help to make that a reality. One of the things that we agreed upon as a federal committee is just the importance of advancing a pro-aging narrative. I think I speak to all on the call that I'm sure share concerns sometimes when we turn on the TV or are in conversations with our friends about how folks talk about aging. And our commitment as the federal government is to think about aging as a strength and to break the patterns of ageism and ableism that often serve as preventable barriers to older adults thriving in the community. And so as we're talking about that work or the work ahead, just wanted to note this key piece for us and our efforts along the way. So on the next slide, you'll see our vision. And again, with 16, now 17 federal agencies, we've been meeting over the course of the last year as an executive team and then in what we called little tiger team meetings, so little work group meetings, to develop a strategic framework to start the conversation about a national plan on aging. We think it's a significant first step, but it is indeed a first step. And part of that first step was creating a vision that we could all row together behind. And so our vision is an America that values older adults, embraces aging, and recognizes that all people have the right to live with dignity, to make their own choices, and participate fully in society. We want to be a nation that prioritizes independence, inclusion, well-being, and health across the lifespan. And on the next slide, you'll see our cross-cutting values. So as we're moving forward in this work, we thought it was really important to root our efforts as a federal government in these core cross-cutting values as we were considering different goals and examples of what we're currently doing to support older adults. And so those four values are person-centeredness. So making sure we are rooting our efforts in the needs and voices and preferences and strengths of the folks that we're serving and that we're working towards. Inclusion, ensuring that all people, regardless of age, disability, or life experience, are able to live independently and participate fully in their communities. I mentioned at the top that this effort was authorized through the Older Americans Act And as part of the Older Americans Act, we work to serve folks with the greatest social and economic need, and inclusion, we believe, really gets to the heart of that. Respect, that all people have the right to live their lives with dignity and respect, free from abuse of any kind. And then collaboration, that all sectors should work together to streamline access to programs, avoid duplicative work, and effectively leverage resources as we work towards meeting the needs of older adults. As I shared, this effort, this national conversation about a national plan on aging began through the ICC, and the ICC leveraging federal expertise per our statute. But in order to make a national plan on aging a reality, we know that it needs to be a multi-sector effort, and that collaboration across those sectors is key. Next slide. As part of that intense process I talked about over the last year, and working with those different federal partners and in our Tiger Team meetings, and drawing upon the statute, so our authorizing statute, we identified 4 key areas to guide our work. And so on the right-hand side here, you'll see what we're calling different domains. So the first is age-friendly communities, and a broad aspirational goal for age-friendly communities. And then below you see areas that we're focusing on within that broad aspirational goal that we believe, if we tackle, will help to make that goal a reality. And the same for coordinated housing and supportive services, increase access to long-term services and supports, and aligned healthcare and supportive services. We intentionally, in the framework, drafted these goal statements in a broad and aspirational manner for several reasons. One being that our intention for the strategic framework is for it to spark dialogue and consideration and engagement across sectors about what things might look like in the future, and what priorities they have. And the other piece of it is that we drafted this with an understanding that across the country, and California really leading the way with starting off with your multi-sector plan, and just the exciting ways that that's being implemented on the ground. But recognizing that across the country, there are exciting efforts underway to advance multi-sector plans, to advance age-friendly plans, to advance state plans on aging, and we wanted to make sure that we used broad enough language to validate efforts across the country, so that somebody in rural Pennsylvania, which is on my mind for a reason I'll talk about in a second, but that somebody in rural Pennsylvania could look at one of our goal statements and say, you know what, we're working towards that here by doing X, Y, or Z. And so that it wasn't too prescriptive, and that the goals, like I said, were broad and aspirational enough that people could see themselves in it. One of the things that you'll note in the strategic framework is that we then provide examples of what the federal government is currently doing to work towards these goals here. In future iterations, we'll dig in a little bit deeper about what the future looks like. But again, the strategic framework was just intended to spark dialogue and advance us towards a national plan on aging. Next slide. In order to accomplish that goal, our goal of a national plan on aging, we know how important it is that we hear from community partners and from older adults themselves. I noted at the top that inclusion and person-centeredness are 2 of our core values. in order to live those values, we need to make sure that we're hearing from older adults themselves and really deploying the principle of nothing about us without us. And so to that end, when ACL received the authority to lead this effort, we had the opportunity to form a co-sponsorship agreement with three nonpartisan, nonprofit foundations, the John A. Hartford Foundation, West Health, and the SCAN Foundation. Two of the three of those have a strong presence in your fine sunny state. To form what we're calling the National Plan on Aging Community Engagement Collaborative, which is also a mouthful, so the collaborative for short, to work with them to ensure that our efforts are rooted in the perspectives of older adults themselves, particularly those with the greatest social and economic need, and community partners, and to help us move towards a multi-sector plan. And so that engages folks across many sectors to advance broad aspirational goals and visions. And so we're so thrilled to have the co-sponsorship agreement that enables us to connect with folks more broadly and serves as the bridge to community as we're doing this work. To start off, the National Plan on Aging Community Engagement Collaborative contracted a group to conduct stakeholder interviews with national and local leaders across the country to talk about the need for a national plan and to get people's pulse on if this is something that they want. And if so, what sorts of guidance or recommendations they might have from the chairs that they sit in. And so we have taken some of the guidance that came from that to heart, including ensuring that we are hearing from older adults themselves. So that was a validating piece of that initial outreach, was just how important it is that we be rooting these efforts in the perspectives of the folks that we're working to support through this National Plan on Aging, and really all of us as we're all aging. And so to that end, we had a listening session, as you can see here on the left-hand side, in Washington, D.C. on May 3rd, with about 75 older adults in Ward 7 of Washington, D.C., which is an area that has historically not been at the table for these sorts of conversations. And we're in the Deanwood Community Center gym and joined by 11 of our, at the time, 16 federal partners, and facilitated conversations that were really centered on hearing from the older adults themselves. So they're all, as you can see here, roundtable discussions. We are on the cusp of hosting 3 additional listening sessions, and to be determined where we'll go next and how we'll approach that. But on Sunday, I'll be driving to rural Pennsylvania. Then on Monday morning, we'll have a roundtable or a listening session, with about 35 older adults, so a little bit smaller. And so we'll be hosting a listening session in rural Pennsylvania for about 2.5 hours, and then grabbing lunch at the local center there with some of those participants and other older adults in the community before hosting a roundtable discussion with local and state leaders to further the discussion. We'll then go to Dallas, Texas on Friday to do the same. So we'll have a listening session in the morning and a roundtable discussion in the afternoon, and are grateful to be able to offer the listening session also to folks who are Spanish speaking. And so we'll have about half of the folks at the table for that listening session be Spanish speaking, with a translator and a note taker and all that jazz, which is exciting and just critically important in our efforts to promote language accessibility. And then in September, we'll be doing the same thing, but in Mobile, Alabama. We also are in the process of developing a community engagement toolkit to help support aging and national organizations who broadly help support older adults or people who are aging with and into disability, or uniquely involved, like family caregivers, in this work, to enable those organizations to seek feedback from the folks that they work with, to then put into a feedback portal, which is on the next slide, I believe. Yes, good. My memory served. We, through the collaborative, have been able to set up a feedback page for feedback on the national plan or the strategic framework. So our first step towards a national plan on aging, and are encouraging folks to submit their feedback, but also for older adults to submit their feedback through this portal. I see that somebody's very helpfully been plugging in the websites here into the chat. So thank you for doing that, to both the feedback page and then also our website that has the actual strategic framework and related reports. I just talked really quickly about a host of different things. I know I just have the 15 minutes and we're nearing that, but I wonder if there might be time just to open it up for some questions and then go from there.
Absolutely, Jennifer. We do have time for questions, just a few minutes. But Lisa Narenberg from the California Elder Justice Coalition had a comment. And our comment was, great to see the focus on elders as rights holders opposed to vulnerable people in need of protection. Would it be great to see justice-friendly communities where elders have equitable access to legal services? So I'd like to speak more to that, Lisa. Please feel free to.
I didn't really have much more to add to that. I like that language. I think with many of us who come from the elder and disabled abuse communities, we've kind of transferred to the language of elder justice as opposed to abuse prevention. And I think that emphasis on elders as rights holders, that these are things that older people are entitled to, is just a really great way of framing it. It also kind of speaks to anti-ageism in public policy. So, and I also, just threw in the justice-friendly communities. That is part of looking at age-friendly communities, that we also be thinking about how to make them more just, more equitable across geography, but also across communities within communities. So I like the reframing, and just, as I'm looking at the recommendations, that those are some of the things that I'm thinking about, is the nuances in the language. So thank you.
Thank you so much for offering that, Lisa, and for validating our strengths-based approach that, again, California in so many ways has helped to lead the way on. And so I would encourage you to use that portal that I mentioned beforehand to offer that feedback for us as we're considering our next steps, and just really appreciate your offering some of that feedback here. So.
Thank you. Any other questions for Jennifer while we have her?
While people are maybe pondering an additional question, please do keep an eye out for that community engagement toolkit that I referenced earlier. I'll make sure to send it to the folks that I worked with behind the scenes on getting here today. But as soon as we have that, please do take a look at it and think about if it might be something that you can use to seek feedback from the older adults and folks aging with disabilities, and the folks in your communities that you think would be interested or impacted by a national plan on aging, and then submit that feedback into the portal. It just, we want to, as I said at the top, make sure our efforts are rooted in the perspectives of the folks that we're developing this plan in mind, and also just know how important it is to hear from community leaders and practice leaders who are implementing these programs on the ground, and likely involved in the implementation of then a national plan. So thank you in advance for your consideration of that as an additional tool as we all work together towards a national plan on aging that validates the really amazing work being done in California and across the country. It's a tool to help celebrate the really great things that are currently happening while thinking about what we can be doing differently at a national level to accomplish just really important goals as our demographics are shifting. And we're navigating a landscape that sometimes does not promote pro-aging language. So just so appreciate all of you and look forward to staying in touch. And please reach out if you have any questions.
Absolutely. Thank you. Thank you. It's really encouraging to see the commitment and strategic planning involved that's shaping our the future of aging and aging services and supports. So thank you, Jennifer. Please feel free to send me any questions or Jennifer directly. I can forward it to her. It is now 12:51. I will go ahead and pass it over to Director DeMorris for closing remarks.
Thank you, Ranjana. Jennifer, thank you for, oh, there you go. She's gone. Thank you for joining us and for the great work at ACL and the slide that I've already forwarded on to lots of people in our administration to show so succinctly everything in one place. I want to thank everyone today. What a fantastic, productive, substantive meeting today. And I really appreciate the questions and clarifications and comments along the way from council members, but also from the public. Just a very engaged dialogue, and special thanks to our three subcommittee chairs, because you really organized the material in a way that made it easy for us to launch into discussion and conversation. So thank you everyone for joining today, for being such excellent participants in the meeting, and for the work that you do in between meetings. We will see you in person October 8th in Sacramento, and very much looking forward to that. And I took lots of notes. One of them, Lisa, I want to circle back. We will absolutely make sure that we extend an invitation to the Attorney General for our October 8th Day of Action. Many other, and I was so interested to learn too about the work that's happening, the interviews from the Secretary that you noted, that we'll be following up on the federal level. So thank you one and all. Great work today, and we'll see you in October.
Thank you, everyone.